My name is Grace Colón. I'm CEO of InCarda Therapeutics, and I've also had the great pleasure of being on the planning committee. And as I mentioned, I also spoke last week on a topic of innovating with new technologies. And it is my great pleasure today to introduce the three speakers in this session. Before that, I'd just like to make a few comments to kind of set the stage for the discussion that we'll be having and tie it to the first two parts of this workshop that's been focusing on this very important area. So as we've been discussing during the first two parts of the workshop, there's a significant gap between the magnitude of the unmet need in chronic diseases and the amount of investment, focus, and innovation occurring in these areas. By many accounts, over 60% of the US population suffers from at least one chronic condition, and 42% or more have multiple chronic conditions, resulting in over 90% of the nation's $3.3 trillion in annual healthcare expenditures. Yet the investments in areas such as oncology, which is still, of course, a significant and terrible unmet need, still dwarfs that in areas affecting a much larger share of the population and which incur even larger costs to the system. These diseases are complex and multifactorial and are hence particularly challenging to manage and treat. For example, diabetes contributes to staggering annual costs of over $300 billion to treat over 30 million patients in the US. Successfully managing these patients requires active and continuous monitoring and treatment required for optimal outcomes. And it also requires, of course, intense patient engagement. However, the discussions of the last 2 weeks here in this workshop have demonstrated that there are new opportunities to innovate, not only along the entire continuum of drug development, from new discovery approaches to innovation in clinical development technologies and approaches, to a much greater focus on patient engagement in all aspects of development, including development of novel endpoints that are particularly important to patients. In addition, the confluence of rapid innovations in things like sensors, wearables, mobile apps, and AI creates opportunities to provide solutions for prevention, early diagnosis, behavioral health, treatment, ongoing monitoring and timely interventions, saving significant costs, and even more importantly, improving outcomes for patients. Importantly, these solutions can provide patients with more control over their own health, something that today's highly informed and connected patients really want. So with that, it brings me again to the session objectives for today, which our co-chairs have laid out. But as a quick reminder, we're going to look at some of these lessons and begin to apply them to specific case studies, so we can really see in a tangible way how some of these new approaches are making a key difference, particularly with respect to patients. With that, I'd like to introduce the first speaker. It's my great pleasure to introduce Robert Coughlin, who is currently Managing Director, Life Sciences at JLL, but for many years was the President and CEO of MassBio, where he demonstrated time and time again great impact and great engagement with patients. And he's going to be talking today about success stories from cystic fibrosis. Bob, I'd like to hand off to you.